Hi, welcome everybody. Thank you for being here. This is the first installment of our postbac career exploration series for this fall, and today we're going to talk about careers in public health. We have some really great panelists, and so I'm excited to hear from them. And before we do that, I'll just address a couple of housekeeping issues. So all of you who are here as attendees, please put your questions in the Q&A. You should be able to see that at the bottom of your screen. You also have the option to upvote and downvote questions. And so if there's something that you really want us to answer, you can upvote it and we'll see that as well. As we go along, we will be using your questions. So please do go ahead and be thinking about those as we get started and put your questions in. Oh, yes, thank you so much. I'm just going to take a second to promote our cart captioner. But yes, please use the Q&A as we go along. We will be using your questions for the panel itself. And so we want to be able to see those and make sure that we're addressing them as we go. I am going to ask our panelists to just start off with introducing themselves briefly and tell you a little bit about both their current role and how they got there. And maybe we could start with Jackie.
Thank you, Laura. I was worried you'd pick me first. Well, hello and welcome everyone to this session. It's something that I really enjoy doing, and especially with my fellow panelists. My name is Jackie Lavigne, and I work at the National Cancer Institute, which is one of the NIH institutes. And I have been at the NCI, we'll use the acronym at the NCI for a long time now, doing something that I really, really love, which is serving as training director, meaning that I oversee the training program in one of the NCI fellowship programs. I work with approximately 140 trainees who are in various stages of their careers, from summer intern through post-baccalaureate, all the way through postdoctoral trainees. And the reason I think I'm here is because the training program is really focused on cancer, epidemiology, genetics, and really public health. Most of the trainees that I work with come from a public health background and are working on epidemiology questions, so working in human populations from all kinds of different angles. My background also includes training in public health. I was originally trained as a basic scientist, and I was working in a school of public health at Johns Hopkins. And as I was doing the work I was doing, we decided to take it into a population study. And when we did that, it was really cool to me to work with epidemiologists and start to realize, oh, I could really make my basic science work relevant to human beings. And I thought I was really taken by that idea and really started to want to combine this basic training, basic science work that I was doing and in the epidemiology work, and think about epidemiology in terms of mechanistic understanding of disease in human populations. And then the flip side, the mechanisms that I was learning about, how to really study those even more deeply in human populations. So after I finished my doctoral training, I got my Master of Public Health degree and then started doing some of that work before kind of going down this other road that of the work that I really love to do now, which is working in training the individuals who are doing that scientific work.
Thank you. And Lily?
Yes, thank you so much. Hi, everyone. It's so nice to be with you all. I am Lily Kahn, and I am the project director for public health data improvement at the Pew Charitable Trusts. And prior to that, many, many years ago, so specifically back in 2003 to 2006, I was a postbac IRDA, like many, if not all of you, working in Building 50 as part of the National Institute of Deafness and Other Communications Disorders. And when I was a postbac IRDA, I was very interested in basic science research, which is what I had the opportunity to do. And I thought I was on track to apply and go to medical school. And during that time, when I learned that not necessarily the pathway that was going to be the direction I was headed, it gave me an opportunity to think through, well, what other opportunities are there out there in the field that really marries my interest in science and the desire to have an impact, and also have an impact on people, which I realize I really love doing. And that led me to learning about public health, especially at a time when many of my other fellow postbac ERDAs were exploring either a track to med school or a PhD program. There weren't many examples of public health at that point in time, but I learned enough to realize that I wanted to get my MPH, and so that's what I did in 2006 and 2007. And after I graduated, I started working for a nonprofit that represents local public health agencies, so local health departments, in the areas of immunization, infectious diseases, and informatics, and so data for improving public health actions. And that was a time before the H1N1 influenza pandemic, so really had an opportunity in that role to support public health in responding to the H1N1 pandemic. And that nonprofit is where I stayed for over 14 years until just at the end of February of this year. So continued to help local health departments in navigating the COVID pandemic. And that has led me to my current role to focus entirely on public health data, recognizing that we've certainly learned over the last couple of years how important data are to the actions that we take individually and collectively to keep us healthy and safe and well. And so I'm really grateful to share any of those experiences, having spent now a few years and learning about what life was like after NIH.
Thank you so much. And Pam, would you mind introducing yourself?
Good afternoon, everyone. It's an honor to be here and participate in this exciting and very important forum. As mentioned, I'm Pamela Carter-Nolan. I serve as the director of the Master of Public Health program at Howard University, which is housed in the graduate school at Howard. And just to tell you a little bit about myself, I have been at Howard University for about 24 years now in various capacities. I'm an epidemiologist by training. I have been in public health all my life. In my undergraduate years, I too was interested, or thought I was interested in medicine. I wanted to be a pediatrician, and mainly because I wanted to help individuals, help adolescents and young children. But I decided that the clinical arena was not for me. So I kind of toyed around with a little bit of business, a little bit of the sciences. And then I had the honor of meeting Dr. William Darity, who was one of my mentors. He was one of the first African-American deans in public health. And so I had the opportunity to work with him, and one summer, and I never looked back. I switched my major to community health education, which at that time was very, or still is, it was very science-based. So I was able to utilize my strength in science and mathematics. And then after graduating, I actually went and worked for the American Cancer Society, where I think that was the most rewarding, one of my most rewarding positions as a field representative. And I got to meet a lot of individuals in the public health field and the clinical arena. And then I decided that I wanted to pursue my master's in public health. So I transitioned to do that. And then I actually began working at the Howard University Cancer Center and met an African-American female epidemiologist, and she introduced me to opportunities to pursue my PhD. So I did. I toyed between epidemiology and biostatistics and decided that I really wanted to do epidemiology because to me, it was working more with the communities and populations, and I could still crunch numbers and design studies. So I decided to do that, and then was afforded the opportunity to return to Howard as a postdoctoral fellow. I served in various capacities as the chair of, vice chair of education and community and family medicine, the assistant dean for medical education. I am the inaugural director of the public health program at Howard University, and I am excited to be here and talk about training individuals because in my current role, I'm more of an administrator. So I've transitioned from the research world of doing cancer research, and I do more training and professional development for young investigators, early stage investigators, postdoctoral fellows, and graduate students.
Thank you so much. And thank you all of you for being here today. So we are going to open it up to questions from our attendees. And I'll just remind everybody, please use the Q&A function to put those in. I'll be looking there more than in the chat. As you think about your first questions, maybe I'll just start us off by asking, since many of our attendees may be transitioning to public health from more of a bench research kind of a space, what are the skills that you need to succeed in a career in public health, and how did you gain those skills?
I'm happy to go first. Because public health, while I was learning about it while at NIH, was still a relatively new field for me. What I found to be most important in transitioning over was having the skills to acquire the knowledge about how different people were putting that into practice in the public health field. And so that learning took place of largely actually conversations that I had with people in the field, people who could direct me to other people. And in fact, Dr. Carter-Nolan, as you were talking about your trajectory and journey and thinking about some of those influential people, having the ability to reach out and if you feel shy, still work through that to ask the questions. I think those are really important because that does put you on the pathway that may not be very straightforward, but is winding and takes you in different directions, but really opens your eyes to all of the different possibilities. And so using the skills that come with engaging with people in that way to learn, I think is really important.
I think in this era of translational research, translational science, you have to be able to think about what you're doing at the bench and translate that, to the clinical arena as well as the population, and just make sure that it's obviously in your unique settings. You want to be able to express findings and research and things like that. But I think it's very important to always think about engaging the community at different levels, whether it's the clinical community or whether it's the population as a whole.
And I'll just add that, as the public health is a huge field, it crosses all kinds of different disciplines, and there are just so many aspects of public health work that you can do. And I think one of the skills is just to appreciate that and to understand that in order to make advances in public health, that you need to be able to work with individuals from a variety of different backgrounds. And by backgrounds, I mean all kinds of different ways to define background, and know that to bring an open mind to learning new languages of areas of public health. And I'll just give an example, which is I am not trained in the behavioral components of public health, but I've had to work with a lot of colleagues that are working in that space. And understanding how behavioral scientists study public health and how they, the questions they bring to the table, the tools they use, has really helped me appreciate the areas that I've worked in public health. And I think an open mind to really learning about the different ways people engage in public health and public health research, I think is really, really important.
Thank you so much. As you're talking about those many different fields and possible avenues within public health, we also know that there are a lot of possible degrees in public health. And one of our attendees has a question about that. How did you choose the degrees that you pursued, and sort of what are the differences in those degrees and in the opportunities that they might afford you?
So I'll just use my journey as an example. So, my undergraduate degree is in community health education. I received my master's in health policy. And then when I transitioned for my PhD, I wanted something that I could, in a sense, utilize all the skills and tools that I obtained going through my academic career at that point in time, and then combine that with my interest. And my interest was really, designing studies. And at that time, I was working on a breast cancer case control study. And so I wanted to, do something where I could design studies and analyze the data. And in my mind, that was really epidemiology or biostatistics. So biostatistics, you do a lot of crunching of the numbers, and not that you don't design the studies, but epidemiology kind of embeds all of that. So I think I just combined what I like to do. And in doing that as an epidemiologist, what we do in research translates to policy eventually. So I think that's how I decided to, combine everything for myself in my career.
I can go next. That I think the question is, public health instead of medicine. And I think, again, like, medicine is a component of public health. And for me, my passion, and it was a matter of kind of stopping and thinking about this between undergrad and going to graduate school. As an undergrad, I studied French, which you don't think of necessarily as a public health area. I had a lot of interest in biology, though. And I worked as a postbac for a while. I think the postbac year is a really fabulous time to really think through what one wants to do next. And I really connected with, like, what is it that I'm passionate about? And I was always interested in the environment and the human interaction with the environment and how we impact the environment and vice versa. And then I had to think about what does that look like in terms of a career? And it's one of the things that drove me towards ultimately what I studied, which is cancer prevention by dietary interventions, and really thinking about how our diets shape us and have an impact on disease risk. So to me, being able to study and do research in that area was, much more of a go down the doctoral path. And I sort of lucked into being in a school of public health, which I didn't even know anything about an MPH until I was in the school and doing my basic science research, and really learning with the epidemiologists that, there's this whole line of study that was epidemiology. So to me, I sort of lucked into it a little bit, but also driven by my interests and passions, it made so much sense to me when I discovered that world, that was a place that I wanted to go.
For me, I knew that I wanted to major in biology, which is what I did as an undergraduate. And as I was graduating from college, I knew that I really enjoyed basic science as well. And so I wanted to further explore that a little bit more, which is what made the postbac IRTA experience such a great fit. During that time, I applied to med school. I got waitlisted, and it was a good inflection point for me to explore whether I wanted to put the time and energy and resources again into trying again. Or as I was starting to get some exposure to public health, go on that exploration and see where it took me. And among the many reasons, some of which were also practical day-to-day kind of considerations, such as the money and the cost for one pathway versus the other, was what had ultimately contributed to some of the other factors that led into my decision-making for public health. In my MPH program, I decided to focus my concentration on infectious diseases, and then within that, vaccine science and policy. And in part, it was because I had realized that I loved microbiology specifically in college and wanted an opportunity to come back to that a little bit. And I thought that perhaps bridging and using infectious diseases to bridge a topic area between basic science and public health would be a nice natural evolution. And as I started taking more classes, learning more about infectious diseases more broadly, and then honing in on vaccine preventable diseases, both the science and the policy aspect, I also just didn't look back. And that pathway then led me to understanding how policy impacts the practice of vaccinating people and preventing them from getting infectious diseases, among other things that vaccines cannot prevent. And so that was my journey.
Thank you. Thank you all for kind of letting us in on that personal career journey. I wonder if you would talk a little bit as well about the opportunities. You know, Jackie, you were sort of talking about the many fields that are out there. What do those different career opportunities look like? And are there some that you might choose to pursue an MPH for versus a PhD?
Oh, that's a really good question. And I'm curious to see what Dr. Carter-Nolan has to say, since she sits with lots of folks with an MPH. And from my perspective, I see individuals, it's, weighing this all the time. Like, do I need an MPH? Can I stop at an MPH? Do I need, am I going to combine it with something else? And everyone's journey is definitely going to be different. And I really encourage people when they come to me and they say, like, I'm really interested in public health, and to first just explore the field of public health and all the different ways, all the kind of different topic areas. Some have come up today, like policy and behavioral health and international work, and just the whole group of that. I'm go check out the Howard program and what they're doing there. I went to Hopkins, and the School of Public Health is just doing all this incredible work in different departments, more community focused, and just listen to what speaks to you, and then go identify people who work in that field and talk to them, and then see, if I stop at an MPH, well, what can I do with my MPH? Do most people in this field just typically have an MPH, or do they often get a PhD or another combined degree? And there's all kinds of ways people combine a public health degree with an MD or a PhD or other types of, with a law degree. I mean, the possibilities are kind of endless, but really it should be driven by what it is that you're passionate about, and where you want to go, and the type of work you want to do day to day, and what kind of impact you want to have. I know that's very vague. It's like the possibilities are endless. Go figure it out. But use your mentors to help guide you and really think through what makes sense, and enjoy that process of introspection and thinking. I think we don't spend enough time doing that, and then really helping. Once you do it, it's like a gift, I always say, that you give to yourself, to spend some time just focusing on you and what it is that you want to do with the work that you're going to be doing.
I think you answered that quite eloquently. It really depends on the individual and what you would like to do. I know, I consider the Master of Public Health, the MPH or MS in Epidemiology or biostatistics. To me, it's the cherry on the sundae, because it helps to bridge many entities. You bridge the clinical arena with the community. And, COVID was a great example of that, because they were able to, quickly, within reason, come up with, a vaccine, but then we had vaccine hesitancy. So we needed the public health practitioners at various levels, from the undergrad, the lay workforce, the master's level, the PhDs, the doctor PhDs. We needed them to help us connect the community, connect the science to the community, help with the messaging and various things. And that's within any health condition or disease. So I really think it depends on the individual, but you have to explore your interests and where you see yourself in the future. I tell individuals, never let the funding sources limit you, because once you obtain your MPH or your doctor PH or PhD, there are opportunities to get the loans repaid through the NIH loan repayment. HRSA has a loan repayment. There's the public health service. So there are various opportunities, but I think you really have to decide what you're interested in doing. And if you think about many of the positions at health departments, you have individuals that are at the master's level that are quite successful. I mean, a lot of our alum have masters and they're out there doing some dynamic things. And I know that's true for Hopkins as well. So I think you really have to just think about your career trajectory and see what's best for your journey.
I definitely agree as well. And when I reflect back on the team I oversaw before joining Pew, it was a team of about 12 to 13 people. And I would say in that particular group, the majority of us had MPHs, but I look at my team now and we're a team of 6 people. 2 of us have MPHs. One is just a few years out of undergrad and so exploring professionally public health. One is in the middle of getting her doctorate of public health. One has a master of public policy. One has a master of public administration. And so I hope that reinforces the journey that can look different for everyone. When I think about the people I've stayed in touch with who were in the post-bac IRTA program around the same time I was, and a number of them have actually gone on to have part or all of their careers in public health, they did also a mix of joint degrees, sometimes getting their MPHs afterwards, some being involved in public health without their MPH, but with another degree. And so it does really vary.
And if I could just also highlight, there are a lot of certificate programs out there now, and not certificate programs as going, to an institution and getting a certificate program, but you think about having your Master of Public Health with your PMP, project management certificate program. There's a communication aspect of the PMP. So there are a lot of opportunities to continue to build your skill set and tie in some of the certificate opportunities as well for professional development.
Thank you so much. A couple of our attendees asked about, making that transition from a post-bac into a career in public health. Do you have advice on how to sort of maximize the opportunities they have now as a post-bac to be ready? And then also as they think about that transition, what's your advice for kind of getting started on it?
Dr. Lavigne, I think it goes back to one thing you said earlier, and it really is leverage the resources that you have available to you during your time at NIH. My exposure to public health while at NIH was specifically having attended lectures with whether it was Julie Gerberding, who was the head of the CDC at that time and doing a guest lecture at NIH, or other lecturers who were coming through, or finding people who are working at NIH in public health and learning from them. That was very important for me in making that transition. I started the program with a very short time window from my NIH to public health graduate experience. And I would say the critical thinking and the ways in which you all think about your work at NIH and continuing to make sure that those skills are a part of your graduate work moving forward, that was really important and helped prepare me well for the type of thinking and the classes and the work that was in the MPH program.
Yeah, I'll just echo one thing that you just said, and that's that there's a lot going on at the NIH in different areas of public health, and definitely take advantage of just being here. And right now it's a little strange because some of us are more remote, some less so, but still we're all working and answering emails, and just find folks that are doing. There's a question about sleep research. I can connect you with a couple sleep researchers who are really doing a lot of work in understanding the role of sleep and different aspects of sleep in cancer. There are probably others doing some work in other aspects of health at the NIH. And then, there's another one about global work, and I can, of course, speak mostly to the NCI opportunities, but at the National Cancer Institute, we have a Center for Global Health, and definitely looking to see on the NIH website, what you can find and learn, and talking to folks like me who can be like, oh, I know about this. And then somebody will connect you with somebody, and you'll start to it's really, I have lots of people that come to me from other institutes, and they're like, can I just pick your brain about this? And that's really fun to do that kind of thing with post-bac trainees who are really just like blooming in their careers. And I really enjoy that. And so definitely take advantage of those opportunities.
As the outside person from NIH, I would echo that. Definitely take advantage of the opportunities, take advantage of the networking sessions that occur at NIH, because I know they have those. Take advantage of the research seminars that occur to just enhance your professional development skills and get to know individuals. One thing you can email someone to see if they will talk to you. The worst they're going to say is no. You use that as a stepping stone to the next level, to the next person. So I think being in that environment, definitely take advantage of the resources at NIH.
Thank you all so much. Somebody thinking kind of far ahead is asking about fields in public health that you see growing or expanding. Where do you see the field going?
I see the field expanding, and really expanding in the area of interdisciplinary work or multidisciplinary work, however you look at it. I believe we use the term interdisciplinary now, because if you think about a lot of the diseases and conditions that we're dealing with these days, and thinking about health disparities, health inequities, it takes a team. It's not just an epidemiologist at the team. You have clinicians at the team. That may be a physician, it may be a nurse practitioner or a nurse. So you have a lot of individuals in the field working together. Another area is big data. You have public health informatics that's really up and growing, and that is an opportunity for individuals to engage, to see, what is public health informatics? How do I, combine the electronic medical record research with my public health experience? These are just areas that encompass all of the diseases, cancer, diabetes, because you're able to do the research or think about the policy aspect of it or the clinical aspect of it. So I think it's important to think about interdisciplinary opportunities, big data, which I know my colleague Lily will elaborate on, but just think about the opportunities that are there for you. I think public health, we were a little silent for a little while, I think. But I think in the past 3 years, the field has really blossomed again, because, and we're needed.
Thank you so much for mentioning that, Dr. Carter-Nolan. And that actually was one of the reasons I made the career shift, and meaning career job shift versus shifting out of public health and stepping away from areas I really love, which was deeply focused on infectious disease and immunization, to now explore, well, what do we, taking a step back, knowing that information and data, big data, all sources of data are so important for informing what we do. Really trying to think through, well, what are the things that we have to do better? What are the things that we have to do that we already have been doing but continue on the trajectory? And what are the things that we need to be thinking about a little differently? And there's a lot of attention and energy and interest in that as well. And like Dr. Carter-Nolan mentioned, because of this interest in public health for this current amount of time, there are also resources in the field to support people in thinking through this. And we all have seen, while we were able to do things to get us through the pandemic that were built on years and years of planning, we still had many challenges that are persisting moving forward, and we need strong and bright minds and passion and energy to be infused into that, to think about how do we work in this moving forward. So absolutely data information, but really thinking about how it connects with different fields within public health in an interdisciplinary fashion, and making sure that everyone who is impacted by the public health system and also the health system is a part of our problem solving moving forward is really critical.
I'll just add, I'll extend, I think the answers given so far are totally spot on. And I'll just extend to a question that I saw about like careers and where do people go. And, you know, I'll just comment on the many trainees that I have worked with, the work that was just described in terms of where the type of work you can be doing is absolutely building on the strong foundation that's already happening. And public health scientists and researchers that are being trained at the NIH are going to places like the FDA, and the FDA pulls together all of this research, clinical and other types of research to make really important public health decisions, as you know. That's happening at in companies too. There's lots of companies that have a population sciences group that the statisticians work with, the clinicians and the epidemiologists to work together to make decisions about what's happening with the company. There's lots of consulting type roles that individuals take on where, you know, they're advising companies that don't have necessarily an internal department to really look at public health related questions related to the products that they're making. The federal government is full of opportunities and organizations that serve the federal government trying to work in the sphere of public health. I think a lot of federal programs interface with that kind of work, and positions like mine and Dr. Carter-Nolan's, you know, like really, there's not that many of us who want to do this kind of work, but I really love it, you know, working with folks that are in training and in the area of public health. And there are lots of programs out there, MPH and other public health programs that need staff that are scientists trained and excited about training the next generation. Internationally too, lots of international opportunities. I think more and more of those types of things, individuals I know going into, whether it's working for a particular nation or working for organizations that are more global focused. Oh, and I forgot to mention one more thing, which is folks who work in the policy arena. And there's lots of policy positions, as described earlier, around the DC area. So it's a great place to be exploring that kind of work.
Yeah, thank you so much, Jackie. Maybe I'll open it up to everybody to comment on sort of what are those opportunities outside of academia, and someone had this question specifically about epidemiology, which I know a couple of you can specifically address, in terms of what do epidemiologists do other than go forward in academia. And then Lily, when we come to you, somebody also asked about what is it like to work at a nonprofit in public health, and sort of how do your public health knowledge and skills play in there?
I'll go first in terms of epidemiology. Outside of academia, you can work at consultancy firms. You can also consider working at the health departments, and then some of the foundations like the American Heart Association, some of the societies, I should say, the American Cancer Society. You have the National Kidney Society, American Public Health Association. So there are tons of opportunities outside of academia where you can consider working. Some of the NGOs, as was mentioned. So I think, you can think about when you're looking for positions. Yes, you may look for the positions that are specific to epidemiology, but think about the research scientist positions or the health scientists, scientific administrators, things like that, depending on your expertise. I think there are many key terms you can use when you are actually searching. But I think one of the things I tell my students to do is to create that LinkedIn profile, because a lot of times many of the organizations will reach out to individuals as they review your LinkedIn profile, and you can do that for free. You don't have to pay for it, and I'm not promoting LinkedIn at all, but it is one of the mechanisms that helps get your name out there and brings people to your LinkedIn page. I'm not the social media guru, but I think in terms of public health practice and research, that is a way to get your name out there.
To follow up on Dr. Carter-Nolan's examples, I certainly echo having worked most closely with epidemiologists working in health departments, both at state health departments and local health departments. And I would even say federal agencies as well. You've already heard about epidemiologists working at NIH. Certainly there are those who work at FDA, CDC, and so forth. And there's actually, and this is a nice segue into the experience of working in a nonprofit, there's a nonprofit organization that represents epidemiologists working at health departments too. And there are also different fellowship opportunities that give recent graduates, whether just out of undergrad or out of another graduate program, for more short-term experiences, just to see if that might contribute to a person's long-term interest in epidemiology at a health department in particular, but in another field as well. In terms of the experience of working at a nonprofit, this having been my second one, I would say that nonprofits or NGOs can really vary in terms of the kind of work that they do and how they do their work. But some of the commonalities that I've seen across my two right now, and then having worked with many, are the mission and the vision that drives a nonprofit is something that I've always really valued as the fuel for the work that an organization does, the work that I've done as part of a nonprofit. The mechanics of how that works then does vary depending on whether it is a nonprofit that supports a group within a community or interests at the local level versus a nonprofit that may perhaps represent national interests, and some of that difference may drive how differently a nonprofit operates. I think nonprofits, depending on how they're resourced and supported, can also drive the energy and the type of work that one can do within a nonprofit. So for example, at my previous role, we were often reliant on federal grants, which impacted the type of work, the scale, and the types of day-to-day responses, similarly to how NIH grants also fund researchers in the type of work that they do. Pew operates a little bit differently, and so currently the way that we are set up, there is a little more flexibility to explore, how I kind of put my thinking and the resources together with the team to do our work. And again, that's just another slightly distinct example, but that still falls under the umbrella of nonprofits.
Thank you so much.
Briefly add also, I'm sorry, I just thought about it as Lily was talking. Also the pharmaceutical firms, there are epidemiologists that work at pharmaceutical firms. So that is, another option. If you think about, wellness is huge these days. Mental health and incorporating, enhancing your psychological health. So many organizations, businesses also have wellness components where they may be hiring public health practitioners as well. So you can think about those opportunities.
Thank you. One of our attendees has a question specific to thinking about getting an MD and an MPH. If you have thoughts on the timeline of how to put that together and whether there are any specific fellowship programs for residents.
I don't know, but go ahead. Were you gonna go ahead?
I was going to say, I'm not sure of any specific residence fellowship programs for residents outside of, specific to residents, but I do know many of the clinicians will pursue their MPH from Harvard University. I believe Harvard has a specialized program, as well as Yale University, as well as, correct me if I'm wrong, Jackie, I think Hopkins may have a program as well for MDs and GWs. So you just have to explore the different programs to see what options are available. And those, programs can be 12 months, it can be 18 months. It just depends on the institution. In terms of, I think there was a question about, a master's of public health versus a PhD versus a Dr. PH. Again, it really depends on, your interest and your career trajectory. I will say a PhD program is going to gear you more towards the research world and doing research. Doesn't mean that's where you're going to end up, but that's, most people that get an a PhD will transition to doing a postdoctoral fellowship. And then that will begin to build their career towards their research career. A Dr. PH is more along the practical aspect. So you might be interested in working more as a practitioner at a health department or at an agency. And so that's really traditionally what the Dr. PH, people that get the Dr. PH are more interested in doing that type of work. One is not better than the other because, you have Dr. PH individuals that decide to get into academia, but it may not be their primary focus to do research, but they are public health practitioners.
That one thing I'll just add to that terrific answer that one thing I recommend for folks is it's really hard to know like necessarily what degree you should go for, but try to figure it out before you invest money because it costs a lot of money to get an MPH. It can cost a lot of money. And if it's a 2-year program, you're not making any money, you're spending, it's really important to think through this. And one recommendation I have, and it is to, as much as you can, sort of figure out what path you might want to be on, and then do some informational interviews to learn more about somebody asked this question, which is a great one. What's your day-to-day look like? What are you doing? What do you love about what you're doing? What's really frustrated about what you're doing? And how, if I were to try to get where you are right now, what would be the training requirements? Do I need to get a PhD? Can I stop with an MPH? What doors are opened if I get a PhD? Because after the MPH, a PhD is, it's many years of making almost no money, working all the time. You finally get your PhD and you're like, oh, okay, finally did it. But it's a lot. It's a big investment in time and money. And it's just so important to think about the right investment as early as possible. And absolutely, you don't know where your path is going to end. And, when I look back, my path seems to make sense. But when I was doing it, it didn't necessarily, I wasn't particularly deliberate. And I think it is important, though, to be deliberate and as much as you can plan for that so that you don't spend more time or more money than you need to, and you get where you want to go sooner. And, you get to build that expertise and become a go-to person in your field, which is the fun part when you get to be there.
If I can just speak to the MPH and MD, I agree. You have to think about what's the best path for you. If you are interested in medicine and you meet the criteria for whatever institution that you are applying to, then you have to think about what's the best path for you. Should you start the medical degree and then take a break and do your MPH, or should you just do the medical degree and look into a preventive medicine program where you will obtain a MPH degree? So you have to think about the best path for you. If you know that your portfolio needs a little, extra something to get you into medical school, then you have to think about, is the MPH the best trajectory for you, or should you look at a post-bac program? Because the admissions committees, they look to see, okay, well, why are you getting your MPH? and not just applying directly to medicine. They think about these things, and you have to make sure that you paint that picture to explain how you're going to integrate public health and medicine. That is very important. Whether you're doing you want to go for medicine, law, dentistry, you have to talk about how you're going to integrate public health in whatever degree you're seeking, because that's very important. And those of us on the admissions committee, we look for that link.
Thank you so much. Jackie pointed out there is a question about kind of the day-to-day, specifically about the day-to-day of if you choose to get a PhD in public health, kind of like what that PhD process looks like, but maybe we could expand it, and along with that, you could talk a little bit about your current day-to-day.
My day-to-day, Zoom meetings all day. I might get lunch, I might not, and I'm just being transparent. My day-to-day is a lot of meetings. We are an evening program at Howard University, so we begin at 5:30 in the evening. I do have a class that starts at 4, but I'm pretty much in meetings during the day, doing prep work, and then I transition to class. I do have classes three times a week. So I might be one of the unique ones that stays in meetings all day. I'm not sure, but that's what my day-to-day experience is right now. In terms of, I can only speak from my PhD program and PhD programs that I'm familiar with. Typically, your first 2 to 2.5 years, you're in doing coursework. You can engage in some research during that time, linking to a faculty member that's doing research that you're interested in. Also, depending on whether you are in school on a pre-doctoral fellowship or not, you have to commit 20 hours a week to that project that you've been assigned to. And then typically after the coursework is completed, you transition to doing that project that's funding your academic career, as well as beginning to think about your PhD project, think about your dissertation and what you're going to do and pursue. For me, it was a three-phase process. I had to pass my comprehensive exam, and then I'm sure this is the same for most of us. And then I transitioned to my proposal defense, and then I transitioned to obviously collecting my data, all that fun stuff. And then I defended my dissertation.
I can go next. Zoom meetings, maybe not Zoom, but meetings online. Oh, yes. Yeah, that's been the last 2.5 years. But we're starting to go back a little bit in person. I would say that the best part of my job is that I get to interact with folks like those of you who are attending this session today, and just talk about these types of career decisions and thinking through what is a really good fit for each of you. That might not seem like public health, but the foundation that all of our conversations are built on are careers in public health. And then thinking about kind of from where longer term folks will be going. So it's really something I love to do. The other thing that I love about where I work at the National Cancer Institute, at the National Institutes of Health, is that the content area of what we're focused on, and knowing that the research that we do, the goal of it, and I think there's this past couple of years are a really great example of that, just the goal of really improving population health. And just, it was amazing to see the scientists who were sometimes working on infectious disease or somehow peripherally working on techniques that would have an impact on the development of a vaccine, just how rapidly the NIH was able to gather all these resources of people and time and build such that we could get to a vaccine in such a short period of time. And that to me was like public health in action. And I was just reading the statement of a young woman who is one of our trainees who's planning to go to graduate school. She's writing up her statement as part of her application package. And she wrote this just the first paragraph of her statement was this beautiful scene where she says she was 13 years old. She was at the doctor's office and they proposed that they said, you know, we really would like to talk to you about this vaccine that we have that will prevent cancer in your daughter, cervical cancer, which is one of the biggest cancers that affect women in the world. And she said, you know, like, the rest of the statement goes on to describe like how she in the moment was like, what, that happened, that exists, a vaccine to prevent cancer, and how now she's really passionate about continuing to work in the cervical cancer field and reaching women in other parts of the world that are suffering from this cancer. And we have a cure. Well, not a cure, but a prevention device. And so it's just, you know, to see that, you know, to be part of that, I think is really what I enjoy the most about my day-to-day-ish activities. And the paperwork and the Zoom meetings I could use a lot less of.
I would echo lots of meetings, a lot of, in the space that is left over, emails or some type of communication, reading, and critical thinking. And I think what underlies it all is something that Dr. Carter-Nolan mentioned earlier, is doing this public health work. Really, it's an all hands on deck approach. It really takes a team. And so for a team of many people to be working together on this, you have to be connecting, you have to be communicating and figuring out the right ways to communicate in all different types of forms, and using that information to then think through, well, what do we do with this information that we have with the people who are available to help think through that. And so the day-to-day really surrounds supporting that.
Thank you all so much. We're coming to the end of the hour, and this always happens quickly. I want to apologize that we didn't get to every single question. I would like to ask one more, though. If you had one piece of advice for someone who's starting out in the public health field now, what would that be?
Know that as you are exploring what your interests and passions are, that there can be a whole different combination of approaches, and to be open to that.
I would say listen to, you know, things that you come across in your experiences, listen to your mentor or individuals that are in the field, seek out opportunities like this panel today, just to make sure that you're enhancing your professional development. If you know that you have some challenges or some limitations, I'm going to use this as an example, because many people don't realize it until they have to do public health writing. Enhance your skill sets. You know, think about enhancing your writing skills, enhancing your critical thinking skills, lifelong learning. Engage in lifelong learning as best you can.
I think those are both great bits of advice, and I'm going to pull together two bits of things that you said. One was the use of the word passion. And if I can, where was I going with this? Passion and get lots and lots of advice, but ultimately follow your passion, you know, like just go out and learn, and then you follow your inner compass. You can't follow it unless you pay attention to it, but just if you're, I really feel like if you're doing something that you're passionate about, it makes work just so enjoyable and not feel like work. And I encourage all of you to keep following your passion in public health, and even just watching some of the, you know, the folks that I'm working with now who are really passionate about the planet and ecological issues, and understanding what's happening and how that affects disease. And I just think it's a new space. We talked about some other new spaces today that public health is moving into, and wow, you know, talk about it and continued exciting opportunities in public health. So go for it.
Laura, if I can answer one question very quickly. The question is, are there opportunities for individuals who may not, in public health, who may not seek advanced degrees? And the answer is yes, there are opportunities for individuals that don't want to pursue advanced degrees. And so you think about community health workers, you think about public health analysts. So there are many opportunities, research assistants, that program managers. So there are opportunities, yes.
Thank you. Thank you so much for getting to that. I really want to thank all of you for your time and your insights and, kind of giving us this hour to really take us through your career journey and share so much knowledge and advice. I also want to thank everybody who's here as an attendee. If you are at the beginning of your kind of career exploration, I want to encourage you to use the resources, as you've heard many times today, use the resources that are available. So we do have career counselors in OITE if you're an NIH postbac that you can take advantage of. And the continuation of this series will actually be next week. The next one is on genetic counseling next Wednesday. And so I hope to see many of you there if that's something you're interested in. Thank you all so much. And I appreciate your time. I hope that you all have a good afternoon.
Thanks for the opportunity, and thank you, fellow panelists.
Thank
Thank
you.
you.
And to you all. Take care, everyone.
Bye.
Take
Take
care.
care.
Bye-bye.